Denver 7 investigates getting results for a Fort Collins woman facing just a shocking hospital charge. Her insurance was billed more than $4,000 for a pneumonia vaccine.
Wow, our consumer investigator Jacqueline Allen shining a light on the larger issue of price transparency in our hospitals.
When she had to spend the night in Poudre Valley Hospital, the last thing Lindsey Messinger was worried about was cost.
So the total bill from UCHealth.
Until she saw the cost.
I thought maybe someone entered it wrong. Maybe there's an extra digit that there shouldn't be.
One charge in particular stood out. A nurse had suggested she get a pneumonia vaccine.
Between the vaccine and the administration cost, it was $4,400.
Her records show insurance would cover some, but not all, $700 coming out of pocket.
I mean, I can see paying more for something at a hospital, maybe double, triple, quadruple maybe, but this was 14 times what I would have paid getting this vaccine at my pharmacy.
And typically, patients usually have insurance coverage for vaccinations in a pharmacy.
Colorado pharmacists say yes, typically the same vaccine would cost a few $100s in a pharmacy. Hospitals are a different story.
So the fact she got it was the appropriate care. The unfortunate part is the, vast difference in pricing that can happen based on your setting of care.
At the federal level, we found bipartisan solutions are being proposed in the Lower Cost, More Transparency Act, passed in the House. Consumer advocates saying something has to change.
That if you're getting a vaccine, it should be the same price, or if you're getting an MRI, it should be the same price regardless of where you get the service. And so those are some of the solutions that are being debated right now in Congress.
This is the second review.
Yes.
Lindsey says UCHealth reviewed her bill twice, no change. So she reached out to Denver 7 Investigates.
I've seen stories and felt like you guys have had a real impact on helping people in these types of situations, so I reached out.
In a statement to Denver 7, a UCHealth spokesperson wrote that generally the price is dependent on the negotiated rate between the insurance provider and the healthcare organization.
Yeah, so it's a voicemail that I got.
That said, after we started making calls, Lindsey got a call. She says her statement is being reviewed and administratively adjusted, so her $700 copay will go away.
I mean, I think that's great for me, but I don't think if I would have made this big of a deal about it, it would have not have happened.
In Fort Collins, I'm consumer investigator Jacqueline Allen.
Well, going in depth now, Governor Jared Polis signed a bill into law earlier this year addressing transparency in medical billing, and it requires hospitals to disclose the cost of their procedures on their websites.
We all can agree that increasing transparency for Colorado consumers and putting teeth by means of accountability for hospitals and other providers who do not follow these transparency rules is important and will save people money.
And lawmakers say the law gives Coloradans a chance to compare prices and avoid getting a surprise bill months after a procedure.